The pandemic and that court fight over the vaccine mandate in New York City schools. Let's get the latest now from ABC's Phil Lipoff right here in New York City. Phil, good morning to you.
Good morning, Dan. That mandate was supposed to take effect Monday. The court's ruling only deepens the divide now between those who agreed with the mandate and those who disagreed with it. Students have been in class for about 2 weeks here in New York City, and already more than 1,100 cases of COVID found in students, more than 500 cases found in teachers. This morning, the battle over vaccine mandates is heating up in the country's largest school district.
I'm going to be terminated. It's going to be my last day.
We're going to lose possibly 10-15% of staff, which means larger class sizes in already overcrowded, unsafe classrooms, which will mean less safe schools for our students.
The mandate, which was supposed to take effect Monday, would have allowed the city to suspend employees without pay if they didn't comply. 10,000 teachers remain unvaccinated, according to our ABC station, WABC. COVID cases are rising among students and staff members, ringing in a concern from parents.
This idea that, well, as long as you have on a mask and your social distance, you don't have to quarantine is a farce, because we know that our babies can't keep masks on for 8 hours, and we know that they're unable to social distance.
A showdown is looming in the state's hospitals, too. A similar mandate requiring healthcare workers to be vaccinated goes into effect Monday. Governor Kathy Hochul preparing to bring in extra staff, even the National Guard, should their hospitals need the help. In Oklahoma, the race to get a booster shot is underway, with thousands eligible. But public school employee Matthew Loria telling affiliate KTUL he is grateful he got the shot.
It's great that we have this opportunity, and I would encourage others to go ahead and get the vaccine.
Healthcare workers are eligible, too.
All of us have gotten our third shot today.
And in Colorado, a former COVID skeptic, 51-year-old Tom Schneider, not prepared for what was next, placed on a ventilator for a month.
My opinion's changed. The risk isn't worth it. You need to get your vaccine because there are so many factors that are random and could take you and change your whole life or kill you.
The United Federation of Teachers fought this decision, so they are happy about it this morning, but it's far from over. The decision now goes to a 3-judge panel on Wednesday for consideration. Until then, unvaccinated teachers and staff are in limbo. Eva?
Phil Lipoff for us there right here in New York. Thank you so much. And joining us now is ABC News medical contributor Dr. Darian Sutton. Thanks so much for being with us. Let's start with those healthcare workers. What's your sense of how many healthcare workers around you aren't getting vaccinated?
Well, good morning, Eva. In my personal experience here in Southern California, most of my team, more than 95%, have been fully vaccinated, and that 5% are partially vaccinated at best. But I know that story is not the same in other hospitals across the United States, especially in smaller community hospitals that may not have seen the surges that we saw here in California or in New York.
I think for a lot of people, the question is, at this point, why would doctors or nurses not be vaccinated?
You know, I've wrestled with this as well. What I found is that as healthcare workers, we are not immune to misinformation. And in my conversations with those who are healthcare workers and may not be fully vaccinated, I often help them sift through the information to feel comfortable in their decision. But I do think that it just requires time, education, and patience, just like we do with our real patients.
With these mandates looming and this concern over shortages, in your experience as an ER physician, what happens when you're short-staffed?
Well, we have been experiencing staff shortages for the majority of this pandemic, especially with nursing. As we have found, nurses feel overworked and underappreciated and exhausted. And it's not just those who are not vaccinated, it's also those who are fully vaccinated. And so we've been trying our best to combat this, but unfortunately, shortages lead to delays in patient care, and patients may not be able to receive the optimal level of treatment. And it also decreases morale of the team.
Let's talk about boosters, too, this morning, because that's pretty new for people. Where do you come down as far as boosters go?
You know, I have to agree with the current decisions regarding booster recommendations. What we have seen is that vaccines continue to prove effective in protecting people and keeping them out of the hospital. The most recent numbers from the CDC show that out of the more than 181 million people who have been vaccinated, only approximately 19,000 have sustained a breakthrough that has required hospitalization. And of that small fraction, the majority are over the age of 65. So I agree with the current recommendations at targeting those at providing additional benefit and getting an additional dose. But I have to say we're doing all of this to compensate for the millions of Americans that remain unvaccinated, because I have to say we would not be in this position if it wasn't for the continued transmission of this virus, which unfortunately happens with those who are unvaccinated.
I think the other thing I wanted to ask you about this one is schools, because we heard in Phil's piece, he was talking about those vaccine mandates and the pushback on them. What happens if there are no vaccine mandates in schools?
We have seen what happens when we don't have vaccine mandates, specifically when we look at state numbers. When we see that states who have no vaccine requirements or low vaccine rates, we see higher rates of hospitalizations and emergency presentations of pediatric cases. We also know that schools that don't enforce mask rules have higher rates of outbreaks. So if we have the same goal of keeping kids safe and keeping schools open, the answer remains clear that the safest, lowest risk option is to get vaccinated. So vaccinating all of those who are eligible in the school and masking all of those who are eligible in the school is probably the best way out of this pandemic, and of course keeping schools open.
And a lot of eyes will be watching to see how it plays out in court. Dr. Sutton, thank you so much for being with us.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.